Good evening, ARC family. Greetings. It is my pleasure to be with you this evening. My name is Dr. Lakesha Butler, and I am an ARC member, but I'm also a professor and pharmacist at Southern Illinois University. I want to first off thank Pastor and Minister Ori for allowing me this opportunity, this platform, to share with you what I know, to share with you insight and information that I have been afforded the opportunity to gain through national leadership. And so just to give you a little bit of information about my involvement with the COVID vaccine before we dive into this, I was recently appointed on a national task force through the National Medical Association looking at COVID-19 vaccine and therapeutic options. So pretty much healthcare professionals such as myself, other Black healthcare professionals, we were hesitant when it relates to this COVID vaccine. So first off, yesterday's word was absolutely on time, on point. Thank you, Pastor, for that as well. We are in some traumatic times right now in our country. We are dealing with political trauma. We're dealing with racial trauma. We are also dealing with medical and healthcare trauma as relates to this global pandemic that has affected so many lives. All of us know someone that have been affected. Either they have had the virus or unfortunately they have passed or have loved ones that have passed from the virus. So this is really hitting home for many, many people. And I know personally individuals who have passed. We've had some in our congregation unfortunately, and also in our families that have had the virus. So it is important for us to address this in the church. It's important for us to not just be heavenly good. We want to be heavenly minded, but also we want to be earthly good as well. And in order for us to be heavenly minded and earthly good, we have to take care of our physical self, our mental self, and also our spiritual self. And so all of that makes up the whole person. And today we're going to be focusing in on the physical health. So we're going to talk about the COVID vaccine, and the ultimate goal that I have for you at the end of this, by the end of this presentation, is for you to be informed, for you to have the insight that you need to use wisdom in making decisions as it relates to whether you would get the COVID vaccine or not. And so I want you to be able to make an informed decision. During my time on this task force, I have been afforded the opportunity to gain a lot of insight and knowledge and information firsthand in talking with the manufacturers of the vaccines. We've spoken with the scientists who have been behind the production of the vaccine with Pfizer, Moderna. Those are the two that have received emergency use approval and that are currently being allocated now in the United States. There are others that are in the works, and we're talking to them as well. Additionally, we've had the opportunity to talk with the FDA. So the Commissioner, Dr. Stephen Hahn, to ask questions, to get our questions answered, the things that we're hesitant about, understanding how this affects the Black community. In order for us as Black healthcare professionals to be confident or in order for our patients to be confident, we have to be confident as healthcare professionals. And so we took it upon ourselves to create this task force and be a part of the process, understand the process so that we can confidently recommend it for our patients and the communities that we serve. So I really want to go ahead and dive into this information. I've got a number of things that I want to cover, but as Pastor mentioned on yesterday, this will not be a Q&A session as previously mentioned. It will be an informational. So I will share with you pretty much all that I know, and hopefully it will answer the questions that you have. So the information, I hope that it will answer the questions, any questions or it will talk about any misinformation that's out there as well. However, if I do not cover your question today, please feel free to reach out to me by email. It's Lakesha@LakeshaButler.com. So once again, that's Lakesha@LakeshaButler.com. So please feel free to reach out to me if you have any future questions. So as I mentioned, we are dealing with a pandemic. This pandemic is affecting so many lives. We have had over 22 million cases confirmed in the United States. We've had over almost 400,000 deaths in the United States. This pandemic is not going anywhere, unfortunately. We are seeing the numbers of cases continuing to rise. Each day, we see hundreds and thousands of cases in the United States. And so we have a problem that we have to face. What can we do in order to change this particular outcome as it relates to the virus? We've also had about 1 million people die globally. So this is a huge deal, and we have to get this under wraps. It's very comparable to the Spanish flu of 1918. I know we don't have individuals in our congregation that probably remember that particular, or were living during that particular pandemic. But during that time, that was a long time ago, same thing. This particular flu was being passed along by the droplets from our nose and our mouth. So individuals were having to put a mask on, social distance or physical distance, and also be sure to sanitize and wash their hands. So unfortunately, during that time, we did not have the medical advancements that we do today. And in addition, instead of 1 million people dying globally, we had about 50 million to die. And we unfortunately, during that time, did not have a vaccine. But we have the information now in order to get this under wraps. And so we'll talk more about that. But I think it's important for us to understand, I'm talking to a predominantly Black congregation, and this has really affected our community more so than others. And so when we look at the comparison of the cases of the coronavirus, we see that it's more likely to occur in minorities. So in addition to ourselves, Hispanics, American Indian. But I want you to pay attention to the deaths. So we are 2.1 times higher to die from the virus compared to other groups. We also have a high chance of hospitalizations as well. And so we've seen the disproportionate numbers of the virus affecting the Black community. And so that's why it's even more important for us to be well informed and to be a part of the solution if we can. As it relates to the willingness to get the COVID-19 vaccine, we have fortunately seen an increase since September of this year, of 2020, compared to December, just last month of 2020. But as you compare the Black, Hispanic, and white populations, we still have the lowest percentage of those who would definitely or probably get the COVID-19 vaccine. And so it is become an important thing that we do as it relates to educating the Black community. The Black community oftentimes doesn't have all of the information. We get bits and pieces, or we may have misinformation. So it is our duty and this is a purpose of ours, Black doctors, Black pharmacists, it is our duty and our obligation I see it as an opportunity to educate my people. And that's why I'm here today. So I mentioned I was totally hesitant, totally against getting the vaccine when the initial discussions were had about it. We know that it has been politicized. Certainly it's come from the current president, the idea that this needs to be rushed and we need to get a vaccine as soon as possible before he gets out of office. The title, as I mentioned, Operation Warp Speed, was an epic failure. So all of that created this hesitancy. Anything, at least from my perspective, coming from the current president, I did not trust. And that's what most people feel as well. But I will say that there has been a very robust process, and I'll talk a little bit more about that. But I do want you to understand that this hesitancy is definitely warranted. We, as the Black community, Black people in America, we have reason to be hesitant. So vaccine hesitancy is just the delay in acceptance or refusal of a vaccine despite the availability of vaccination services. And it's usually influenced by what we call the 3 C's, either complacency, convenience, and confidence. And I have really made the confidence bubble bigger because that is the most likely reason for our community to be hesitant and to not obtain a vaccine. Basically, the confidence comes from our mistrust and also from safety concerns. Now let's talk about this whole idea of mistrust. We have a reason to not trust the process of medicine. There has been numerous examples and reasons for there to be this idea of we are guinea pigs and I don't trust the process, the clinical trial process. So we're very familiar with the Tuskegee study of untreated syphilis in the Black male. And this was started in 1932. Basically, it was looking at the effects of untreated syphilis in Black men. We had individuals who had syphilis and those that did not. But the kicker was in 1945, penicillin was discovered to be the prime treatment for syphilis. It cured syphilis just like that. Despite the creation and the revelation of penicillin, this particular study did not end until 1972. And specifically, those Black men who had syphilis did not receive penicillin. So despite us finding a cure for a disease that caused a number of morbidity and mortality, it caused death, it caused people to be blind, other issues as well. So even though it caused that in the Black male, we had a treatment option for it. They were still in the study. They wanted to see the effects of untreated syphilis. So that was completely unethical. And it showcased racism in our healthcare system. But even before that, dating back to slavery, the picture on the right, it shows you the punishment of a condition that was completely made up called drapetomania. So drapetomania was a condition. It was a mental illness condition that was, like I said, made up by whites, slave owners, that basically said if the slave ran away, they were mentally ill. And so when they came back, they were beaten. Certainly this was just a way to keep the slaves under the authority of the slave master. Drapetomania was not a true condition. I can talk for days about the whole process of, racism in healthcare, but drapetomania, that is the reason why there's such a stigma associated with mental illness in the Black community. Don't call me crazy because they told my ancestors that they were crazy just for running away. and beat them. And that has transitioned from generation to generation. We've been socialized to think that mental illness is it's a stigma, and don't label me as that because it's not true. But that's far from the truth now. We have to definitely deal with the trauma that we have experienced, and that has been passed down from generation to generation, but that's a whole nother story. Also, the middle picture, that is a picture of Dr. Marion Sims. He is known as the father of modern gynecology. He's on the right in the bow tie. Basically, this picture depicts how he performed surgeries on Black women without anesthesia. So Blacks were considered or thought to experience less pain, but they were the subjects, unwanted subjects, undesired subjects of this experimentation without anesthesia. So these are just some examples. Certainly, we still see examples of racism in healthcare. Just recently, Dr. Susan Moore depicted and talked about her experience and recently passed away from COVID-19. She talked about the racism that she encountered in the hospital. So we're still experiencing it. And so we are looking at any type of new drug, clinical trial with the side eye. And it's definitely warranted. Also, we're just concerned about safety. We want to make sure that the side effects are not bad side effects. So all of that is playing a part in the reason why Blacks in particular have a lower percentage of wanting to actually get the vaccine. So totally understandable. Like I said, I was hesitant as well. But since all of that, we have certainly had a number of advancements in medicine and clinical trials. So certainly nothing like the Tuskegee syphilis trial can happen again. We have gatekeepers in place. The process has to go under rigorous scrutiny, and it has to be also a transparent process. Clinical trials have typically included only about 5%. Some have also only included about 1 to 2% of Blacks. And so therefore, we didn't necessarily know how a drug or vaccine affected the Black community. But these particular vaccine trials, they have been very intentional about having Blacks involved. And so the average percentage of the Black the population or study population is about 10% Black. And so that's really good. It really helps us to see that, the effects or the outcomes of the clinical trials, we can translate to the Black community as well. Also, we know that there's a more ethical process, there's informed consent, but also the vaccine process has been well advanced. The vaccine technology that we're using today has been developed over time. It's actually been in development for about 10 years. So this is not something that has been rushed. It has been, the process has been perfected, and we are in a place that now we see, just like we see with technology, these advancements have been beneficial as it relates to the outcomes in the vaccine. So just to give you a little bit of information about the clinical process, the clinical trial. So there are different phases. There are 4 phases. There's phase 1, phase 2, phase 3. Phase 1 is usually looking for safety. So we're looking to see if there are any unexpected side effects that can occur. And so if there are unexpected side effects that occur, typically that particular candidate that we call it, they have to stop the process. So they no longer can progress to phase 2. After they've checked to see that it's safe, we move to efficacy. So this is making sure that the candidate is effective and doing what we want it to do. And so in the case of the COVID vaccine, we're wanting it to protect us from contracting the virus. And so we were able to check for that efficacy in a smaller population, phase 3. we are able to confirm the findings in a larger patient population. And so with these particular vaccines that have been approved for emergency use, we have seen these particular clinical trials enroll over 40,000 participants each. So in the Moderna trial, we saw over 40,000, and also in the Pfizer trials, we saw over 40,000. So that is a significant number that certainly helps us to see the effects of how it would be on the general population. So certainly that's important to note. Once we saw how effective the two vaccines were, that is when emergency use approval was applied for. And it was a long process. They had to outline the types of people, the conditions that they had, everything that was found, the data, the side effects, all of that had to be clearly outlined in this application for emergency use. And it went through a rigorous approval process by the FDA. So now we have these FDA approved vaccines. So what phase we were able to cut off is that phase 4 portion. Phase 4 is when we continue to look at that long-term effect of a particular vaccine. And so we're just following the individuals, having them to track whether it's just documenting what side effects they have or what other issues they may have from the vaccine. That is the piece that we're missing. We have only been able to follow the clinical trial participants for 2 months after the both doses of the Moderna and the Pfizer. So that is the piece that is missing. We're continuing that for those who are getting the vaccine now. But what I want you to know is the phase 1, phase 2, and phase 3, what it showed us is that these vaccines are effective. We saw 95% effectiveness. And so basically what that says, we have a room of 100 people, that 95 of them, if they have taken both doses of the vaccine, will not obtain or will contract the virus and will therefore not get sick from the virus, will not die from the virus. So that is a pretty significant percentage of effectiveness. All right, so it's also important to note that with COVID-19, this is novel. We have not seen a virus like this before. It is completely new. And so therefore, we are also tracking the long-term effects of COVID-19. So individuals that have contracted the virus, most often they will say that it affects their lungs, so their breathing. Also, we're seeing a common effect on the smell and taste as well. But now that we have been dealing with this virus for almost a year now, we have also been able to see that it not only affects the lungs, but it's also affecting the kidneys, and it's causing acute kidney damage. It's also affecting the brain. Many patients that have had the virus are stating that they are having memory issues. There's also some instances of stroke associated with COVID-19. And also the heart, which is, all of these are critical organs in our body. As it relates to the heart, we're seeing that individuals are experiencing heart failure as a long-term effect of COVID-19. So I think this is important for you to understand that these long-term effects of COVID-19 that individuals are seeing are pretty significant. As it relates to the vaccine, we are not seeing these effects. What we are seeing is that individuals may have some short-term effects based on the way that the vaccine works. But these long-term effects in comparison to what is being experienced by the vaccine are night and day. Recently, just January 7th, there was a study that was released, and I'm a nerd, I'm a professor and a pharmacist, and so I keep up with all of the literature, or I try to at least. But this in particular, it was looking at a large cohort of individuals who have had COVID-19. And what they saw is that about 59% of individuals who had COVID-19, it was transmitted from people without the symptoms. So many people are getting the virus from people that don't have symptoms. So we could be in a store around people, or we may be at work around someone that does not have the symptoms yet. They're coming to work, don't feel bad, but they may be wearing their mask under their nose, or they may decide not to wear their mask at all. So that is where the majority of the transmission of COVID-19 is occurring. And so this becomes even more important for those of us who are on the front lines, who are interacting with patients, interacting with the public. We are at great risk of contracting the virus because people aren't having symptoms and they don't think that they're sick, so they're doing their normal routine each day. And that is continuing this pandemic. It's continuing. Like I said at the beginning, it's not going anywhere, unfortunately. So this gives us even more reason to obtain the vaccine when available for you. Now, when we talk about the vaccine, it is important for us to talk about the differences. So there are two that have been approved for emergency use. We have the Pfizer or Pfizer BioNTech, or we have the Moderna. So both of them are very similar. They come in 2 doses. So you get the first dose. Specifically for Pfizer, you wait 21 days and you get the second dose. For Moderna, you get the first dose and then you wait 28 days and get the second dose. So after the first dose, you are about 50%, or there's a 50% chance that you will not be affected by the virus. It's not until that second dose that you have that 95% effectiveness protecting you from the virus. There are a couple of differences in addition to that, the gap in between the first and second dose. The Pfizer is approved for those who are 16 years of age and older. Moderna is 18 years of age and older. The storage is different. So Moderna can be refrigerated. Pfizer has to be stored at sub-zero temperatures. Very difficult. Definitely have to make sure that it stays stable in the environment that is needed. The effectiveness was across both genders and races, so we don't see any differences. The other thing to note is that the population, the study population, so about 20,000 received the vaccine in these clinical trials, and about 20,000 received what we call placebo, or no vaccine. So they just were injected with saline or salt water. Within those particular groups, they were matched so that we could clearly compare them. As it relates to those who received the vaccine and those who didn't, many of them had chronic conditions. So the study populations include those who had diabetes, included those who had high blood pressure, asthma, COPD, sickle cell disease, which is common in the Black community, heart disease. So all of those common chronic conditions, individuals who had them were included. So this is, once again, it can be the results that 95% effectiveness can be generalizable to the general public. What we saw with the side effects is the same type of reactions pretty much. So I can personally say that I just last week had the first dose of the Moderna, and the most common side effect, I did have it was arm soreness. So right after the injection, which the injection was a very slight pinch, I had the arm soreness for about 2 days, and that is a very common side effect. About 80 to 90% of those who did get the Pfizer or the Moderna vaccine experience this arm soreness. Okay, so that is something that you can expect. The other common side effects are what we call an immune response. So you may get this tiredness or what we call fatigue. There may be a headache or muscle pain, some chills or a fever. All of that is an immune response. So why do you get this immune response, you may ask? So the mRNA, these vaccines are utilizing the mRNA technology. And what that is it's a part of our blueprint in our body. And so when you think about, a blueprint with a house, you kind of see what actually, should be built or where the rooms are, the stairs and all of that. So the blueprint is our DNA, but the mRNA actually is the contractor. So tells the construction person where to place everything. So messenger RNA tells our body or our cells what to do. So with this particular messenger RNA, it does not affect our DNA. It does not inject into our DNA. This mRNA, it is it's injected, so it's basically a messenger, it's a message or it's instructions that are injected into our arm. It is surrounded or encapsulated by fat so that it gets into the cells and it doesn't break down before it releases the instructions. So when it gets in, it basically tells the body to create a small portion, a small harmless portion of the spike. So if you look at that top right corner of my slide, that is a picture of the coronavirus, and it has these spikes. Those spiked proteins, that's actually why when the coronavirus gets in, it's able to, what we say, debug the body. Because of those spiked proteins, it gets in really easily, it pokes a hole, and it affects the body, and therefore we have the symptoms and outcomes of the virus. But we are injecting this messenger RNA that causes the body to create a harmless portion of that spike protein. When it creates that harmless portion of the spike protein, basically it tells the body that this is foreign. The body knows that this is foreign, and it elicits an immune response. So with that immune response, antibodies are created, and the body begins to attack that particular protein. But what's important is it also attacks anything that looks like it that gets introduced into the body. So the body has now created these antibodies, and these antibodies are fighters against this foreign object or anything that looks like it. We have what's called T cells and B cells, and they're memory cells. So the body remembers, it remembers what this looks like. And that's what we want. We want the body to remember if we were to come in contact with anything that looks like the coronavirus, that spiked protein from the coronavirus. And that's what makes it very unique, is that spiked protein, those spiked proteins are all over, that's the red portion. So if we the body comes in contact with that, it's ready to fight it off completely. And this triggers an immune response. So when we're creating the antibodies, this causes us to have these chills, the fever, potentially the fatigue and headache. So that's a good thing. This lets us know that the body is doing exactly what it is doing. And so in addition to the arm soreness, I too had the fatigue for a couple of days. I felt tired, but I continued to push through. Actually, after the day that I had the vaccine, I did take a 2-hour nap when I got home from work. But other than that, I was able to push through and continue my daily responsibilities. Another important thing to note is allergic reaction. So for individuals who have a history of a severe allergic reaction, we call it an anaphylactic reaction. It is important for them to talk with their doctor about it. So anytime you are in a setting receiving a vaccine, there are protocols in place. So because I'm a pharmacist, I am certified to provide vaccinations. And so I have to be CPR certified. Also, we have to have Benadryl, epinephrine. We have to have different medicines around in case you were to have an anaphylactic reaction. So those particular individuals, there is a higher chance of potentially having an anaphylactic reaction or an allergic reaction from the vaccine. And so for those, they typically are required to stay around longer after the vaccine so they can be monitored. But it is important, if you have questions as it relates to that, definitely reach out to your doctor to get their opinion. One other thing I wanted to mention is it is important to have that second booster. So I have had the first one. I have to receive the second booster from Moderna, so I cannot switch to Pfizer. And also, I've had questions of, well, which one's better? They are pretty much the same as it relates to the effectiveness, and that's the important piece. The major differences I've noted here: the storage, the age that they have been approved for, but they work the same. It's the same mRNA technology, their effectiveness, their safety, the side effects that you can experience. So you typically, if you have the opportunity to get the vaccine, you're not going to be able to choose if you want to get Pfizer versus Moderna. It's whatever is available. And I know in the St. Louis area, this metropolitan area, both are available. It just depends where you are actually obtaining the vaccine. So as it relates to the priority groups, right now, we are in what we call phase 1A. And this is the vaccine is being made available to those frontline workers, those healthcare workers, so doctors, nurses, pharmacists, all of those that are in the hospitals that are interacting with patients. They are being vaccinated at this time. Also long-term care or nursing home facility residents, because they are in close quarters, they are at one of the highest risk of contracting the virus. So that's about 24 million people. We are still in that phase. We're getting ready to, move to the 1B phase. So this would be those frontline essential workers. So those that work for the grocery stores. This could also include teachers. So those that are still in close contact with the public, but they're not healthcare workers. Also those that are 75 years and older. So some states have already moved to the 1B phase, but many states are still in the 1A. So kind of the rollout has taken a lot longer than was expected. We expected for us to be in each phase for about a month, but it is lasting a little bit longer. We're learning as we go with this process of rollout. So I know there are many of you that maybe work in a hospital and you have been offered, or you're a frontline worker, essential worker, and you've been offered the vaccine. So I would encourage you, just based off the fact that it is safe, the side effects, excuse me, the side effects are very minimal. It's what we expect when you actually get a vaccine, because you are either introducing a portion of the virus into the body, or you're causing the body to elicit an immune response. So those are the side effects that we saw. We did not see serious adverse reactions. So it was very comparable. 0.5% of individuals in the study population compared to 0.5 or 0.4% in the placebo population experienced serious adverse events. So very comparable. So we know that those serious adverse events were not due to the vaccine because of the comparable rates. So most likely those serious adverse effects that happened in the trials were because of the pre-existing conditions that the participants had. So once we move past 1A, 1B, we'll move into 1C. Those are individuals that are between the age of 65 and 74. Also those who are between the ages of 16 and 64 with high-risk conditions. So any of those comorbid conditions, heart disease, diabetes, hypertension, asthma, those would be considered high-risk conditions. And then any other essential workers that were not covered in the 1A and 1B. And then finally, we'll move into phase 2, and that would be our general rollout for anyone that was not included in phase 1. And so we're expecting these phases to continue at least probably through to the summer. We're hoping by the spring that everyone will be vaccinated who wants to be vaccinated. So, none of this is mandated. Some hospitals and healthcare sites do mandate the flu vaccine, but the COVID-19 vaccine is not mandated at this point. It is highly encouraged, definitely, especially for those who are at risk. Now, I want to talk about some of the myths. So I know there is a lot of misinformation that is out there, and it's very difficult to determine what's truth and what's not. So a couple of the myths that I want to cover is, I've heard about this, I guess it's what they call a conspiracy theory, that you are being injected with some type of chip that will trace you for the rest of your life. And that is completely false. There are no tracers that are a part of this particular vaccine. That could not be done. That is unethical. And so because of the rigorous process of clinical trials and approval through the FDA, the CDC, that could not be done. The other myth is that this can give you the virus if you take the vaccine. And as I mentioned, it's very similar to the flu. So the flu doesn't give you the flu. The flu vaccine does not give you the flu. The COVID-19 vaccine does not give you the virus. We are eliciting an immune response because both of the vaccines, the flu and the COVID-19 vaccine, are inactivated. So we're not injecting the live virus into you, so you cannot get the virus from the vaccine. There's also no evidence that the vaccine will cause infertility. So there's a lot of misinformation as well regarding infertility. Certainly, the population that was tested in the clinical trials, they were not specifically looking at women who were pregnant. They were given, the women were given pregnancy tests before the trial started, and they were encouraged to not get pregnant, but there were some who actually did get pregnant during the trial, and they are being followed. But those that did get pregnant and were followed, they did not have any, there have not been any issues with the fetus or with the baby. So there was this false internet claim that I saw that the vaccine spike protein cross-reacts with a protein that is important to placental formation, and that is completely false. It does not contain any type of protein that cross-reacts with the placenta. So the American College of Obstetrics and Gynecology, that group, they recommend that, or they encourage patients who are pregnant to consider the vaccine and certainly talk about it with their doctor. One thing to note is if you are pregnant, there is certainly a higher chance of problems, and if you were to contract the virus. So there are worse things that could happen. Unfortunately, there could be death associated with contracting the virus while pregnant. Individuals who are pregnant, they are at greater risk of worse outcomes if they were to contract the virus. You can actually get the virus after the first vaccine dose. So there was this myth that if you received the first vaccine dose that you were protected. So the media was pushing out that some of the nurses had actually contracted the virus after getting the first dose of the vaccine. And so that's very possible. I mentioned that you are, the effectiveness is about 50%. So 1 in 2 people could actually get the virus just after that first dose. So it's very important to get that second dose. And then I talked about changes our DNA. It definitely does not change our DNA. That's not how mRNA works. It's a messenger. It does not get into the blueprint of our body. It actually just causes the body to create a harmless small portion of the spike protein to elicit a response and get these antibodies working, get those T cells and B cells working so that they remember what this looks like, and anything that looks like that particular portion of the spike protein that was created, it will attack it right away and prevent it from actually getting into the cells and causing negative outcomes. So all of these are definitely myths. I think another piece is that, all of this is being pushed by the government, and, a current president, he was the one who made the FDA skip some steps, but no steps have been skipped. In actuality, this particular vaccine process has had more eyes on it than any other particular vaccine or drug that's going through the approval process. So I can say personally that I've been being a part of the process, that I trust the process, and I have seen firsthand how they have been following the process and have been very diligent and being transparent in the process as well. So with all of that said, certainly, this is information that I want you to take in, reflect on it. I definitely want you to be able to make an informed decision. In all that we do, we want to use wisdom. And so once again, as I started out, we're in a pandemic, and in order for this pandemic to subside, or for us to get back to any sort of normalcy, this vaccine is the answer. So we know that the vaccine will help to decrease the number of cases, decrease the number of hospitalizations, decrease the number of deaths associated with the vaccine. Especially for those of you that are out in the public, I encourage you, if your time comes to get the vaccine, to please do it, because you're not only protecting yourself, you're protecting your family, you're protecting those around you, and you're helping to be a part of the solution. I just know, once again, that the hesitancy that I had, it was real and it was warranted. But I stand before you with knowledge and insight to say that you can certainly trust the process. So we are still continuing to follow the effects of the vaccine long term, that we don't have that information. But I can say, you know, I've received the vaccine. I wouldn't tell you to do something if I didn't do it. And I was ready. I was more than ready to get it because I want to protect myself and my family and others that I come in contact with. So even after getting the second dose or even the first dose, we still have to practice these particular practices of washing our hands, physically distancing, and wearing a mask because not everyone is getting the vaccine. And it's going to take time for us to reach what we call herd immunity. And that is basically where about 50 to really, we say more like 70% of the US population has received the vaccine, and that's going to be a while. And once we reach that herd immunity, that is when we will most likely be more protected, and there would be a very low chance of the virus continuing to spread. So we've just seen the effects of the virus over just 1 year. So many lives have been lost. To know for myself, if you know, I'm anxious. I've been very anxious about not getting the vaccine because we don't know how it affects us. Some people it affects worse than others. Some people, they may not have any effects now, but we are seeing these long-term effects as well. So let's be a part of the solution. Once again, using wisdom, want you to make that informed decision about this. Certainly, as I get more information, I am more than happy to share it with you. There will be more vaccines that will come out. So once again, I want to thank Pastor and Minister Ori for the opportunity to be here with you all. And we'll end with our motto: one God, one love, one church. Be blessed. Thank you all so much for joining us this evening. Take care and stay safe.